Well, good evening, ladies and gentlemen. Dr. Taggart, Minister for Health, Minister for Mental Health, Members of Parliament, Director General and distinguished guests. Thank you for giving me the opportunity to talk to you this evening about a project we're very proud of, the Liverpool Hospital Staphylococcus aureus Bacteremia project, or as we call it, LivSab. Hospital and healthcare associated infection can have a devastating impact on our patients and their families. One of the most serious of these infections is Staph aureus bloodstream infection. Staph aureus, which is better known as golden staph, is a microorganism that lives quietly on the skin and in the nose of many of us, not causing any problems. When it gains access to the bloodstream, it can cause serious infections, such as bone and joint infections, particularly in artificial joints, serious skin and surgical wound infections, abscesses, pneumonia, and even heart valve infections. These infections often result in long courses of antibiotics, extra tests, operations, longer stays in hospital, and sometimes, unfortunately, even death. About half of Staph aureus bloodstream infections occur in the community, but the other half occur in hospitals or in people receiving medical care in the community, such as kidney dialysis or chemotherapy. We know that this type of infection is a complication of modern healthcare, but we believe that most cases are preventable. 2 years ago, we started the LivSab project to reduce Staph aureus bloodstream infection related to medical care at the Liverpool Hospital. In our project, we investigate every case in detail. We look for the causes and for what may have gone wrong in our care for the patient. Visiting the patient is an important feature of our project. It can help us determine the cause of the infection. Our investigation findings are fed back to the doctors and nurses who looked after the patient. The feedback is timely, formal, and identifiable, linking a real person to the event. We clearly state what we believe went wrong, and we suggest ways that things could have been done better. By finding similarities, we can help redesign work practices to prevent future cases. Through our LivSab project, we found that IV drips and cannulas were the most common cause of healthcare-related Staph aureus bloodstream infections at Liverpool. This really hadn't been recognised before, and we are targeting the insertion, the day-to-day handling and the removal of these devices with improved procedures, monitoring and education of our staff. Patients receiving kidney dialysis are particularly vulnerable to this infection due to the frequent use of long-term dialysis catheters. We have recognised that this is a priority for our improvement program as well. We're also looking at ways to better protect and prepare patients having surgery to reduce the risk of Staph aureus bloodstream infection as a post-operative complication. When we started this process, we recognised that many healthcare professionals did not realise that Staph aureus bloodstream infection was a potentially preventable infection. We have raised awareness of this infection at Liverpool Hospital with regular reports and newsletters, displaying and comparing our performance regularly. Our hospital takes responsibility for the Staph aureus bloodstream infections that occur under our care, and we try hard to prevent further cases. Before our project started, our rates of infection were frequently above the target set by the Ministry of Health. Following our intervention, we have reduced our rates to about half. We estimate that this project alone has prevented 58 cases over 18 months and may have saved up to 15 lives. Recently, we have recorded 2 months without any cases, and we are striving for more results like this. Our success so far has encouraged us to expand this project to all of the hospitals in the Sydney South West Local Health District. We already have it running at Fairfield and Bankstown and soon hope to include Campbelltown and Camden hospitals. Whilst the size and the activity of hospitals can vary substantially, the causes and the preventive measures we are working on are universal. We hope to use these techniques from our project, such as the immediate investigation, the feedback, the ownership and the accountability to tackle other problems in our hospital, particularly other healthcare associated infections. Our goal is to make our hospitals safer for our patients. Thank you.